The mortality rate from the current West African Ebola epidemic ranges from 50% to some 90%. Failure up to now to control the spread of the virus results from the region's unfamiliarity with the disease, made worse by deep popular suspicion of those in power in the aftermath of civil wars. Ebola has affected Nigeria, Liberia, Sierra Leone, Guinea, and Senegal. Here are 3 things to know about the Ebola epidemic and West African governance issues. First, Guinea, Sierra Leone, and Liberia, the epicenters of the disease, are characterized by a low degree of popular trust in their respective governments. They have poor to non-existent health systems and are recovering from civil war. Many of the affected populations have a pre-scientific worldview, with some seeing Ebola as the result of witchcraft rather than a virus. Accordingly, many victims and their loved ones have resisted government-sponsored efforts to control the spread of the disease. The second thing to know is that popular suspicion of government puts a premium on a communication strategy about Ebola and how to respond to it. But the challenges are great. Literacy levels in West Africa are not high, and there are multiple languages spoken in the region. In all 3 countries, efforts to educate the population about Ebola were developed late, and their effectiveness is difficult to measure. The third thing to know is that the affected African states cannot stop Ebola without outside help. Quarantine, tracing contacts, and treatment for Ebola victims requires the resources that only the international community can provide. International efforts, similar to the global response to the South Asian tsunami, could help stop the spread of Ebola in West Africa. The Centers for Disease Control estimates that the number of Ebola victims could range from 550,000 to 1.4 million by January 2015. Unless these governance issues can be resolved, local governments lack the ability to bring Ebola under control, and a greater international response will be required.